Dr. Eisenberg, thank you for your time.
My pleasure.
Why don't we start with you telling us how you ended up here at UT and a little bit about your career here and what keeps you here, what you like about our institution.
Well, when I came to the United States in 2003 from Argentina, my initial contact were always with doctors from the University of Texas. I met people in infectious diseases, more specifically in the world of HIV, in the Thomas Street Clinic, the big HIV clinic for the county. And one introduced me to another, and so on. And eventually, when the moment came and I had my steps 1 and 2 ready, I applied to the infectious diseases program. My intention initially was to complete the training in ID, and I didn't know if I was going to stay, but I liked it. And after a year and a half and so, I met the then program director. I worked with the program director then. And I decided that it was a good place to retrain to do my new internal medicine residency. Full disclosure, I had my internal medicine residency prior in between 1990 and 93 in Argentina. I was a chief resident faculty, but it was a more than suitable program to stay. So it was a no-brainer. Once in here, UT all the way.
And what do you do now? What is your responsibilities and interactions with the residents?
Okay, so after I was done with my ID training and my internal medicine training, I was lucky to do it in 2 years because of my history, but that doesn't happen to most people. I left for a few years to the private world, and then I returned as a member of the faculty. I rapidly advanced to becoming a division chief of general medicine in LBJ. Lyndon B. Johnson Hospital is a safety net hospital. We serve the underserved community of Houston, people close to the line of poverty, and I think we give them more than good care. We have pretty much all the specialties. So far, we lack the cardiac catheterization suite, but we have interventional radiology. The county is building a new hospital that is at least 3 times larger than the current one. So in that one, we will have neurosurgery and interventional cardiology. So we're headed in that direction, but so far that's the only thing missing. My role there as a division director is to support our faculty on anything related to their practice there. And as a member of the faculty myself, I cover half of the month every month, conducting bedside teaching, helping people with their physical examination skills, all the fun stuff about medicine.
I know you do a significant amount of teaching for our medical students and residents. So how would you describe a UT resident? It's usually kind of hard for applicants to figure out if they would fit in here when they're doing a virtual visit.
I think what we try to encourage them to be is passionate people that look and feel like the persons they describe in their personal statement. When you say why you want to become a physician, or more particularly an internal medicine physician, they describe their best self there, and I try them to be connected to that romantic image of themselves. It's interesting because I warn every resident in every program in this nation and everywhere, since I practiced elsewhere before, that at some point you feel underfed, underpaid, overworked. It's inevitable that you will have that feeling, and why this is the worst place in the world. And everybody has that feeling at some point. The important thing is that because of the fact that everybody has that feeling, it's important to feel connected and to share that experience with others. And remember, all the faculty were residents before, so we struggle at some point. Just be open and remember that our patients have it worse than you. So you're still the lifesaver and the hard worker, and the intention must prevail. I mean, this is a place of learning. You don't go to a place to learn because you know everything and you want to show how much you know. It's because you are ready to accept the challenge of taking up new stuff. Every patient is a world, and we learn from them every day. And I'm I like to describe myself as a PGY32. So I keep learning even after so long, and I love what I do. So I try to make that love contagious.
I love that perspective. I really agree with you. I think we all learned so much at LBJ and are grateful for the opportunity to work there and serve the patients. Can you tell me a little bit more about our practice at LBJ, the patients we see there, and our opportunities for education?
Yes, of course. And it's interesting, you asked me about LBJ because that's where I spend most of my time. But if there's something amazing about our program is that we may have the same patient or patients with the same condition with somewhat different approaches because of what we have at hand at Memorial Hermann, at MD Anderson, different at the VA, different places offer different perspectives sometimes. LBJ is, as I said before, a safety net hospital, and that implies that sadly, the way things are set up in the American healthcare system, many of these patients arrive to us only when they are sick enough and they never sought care before. So in a sense, it's an opportunity to see what the natural evolution of a disease in a particular person looks like. On top of that, we have the bread and butter of internal medicine. I mean, predominant cardiology, oncology, pulmonary, and critical care. But then we have all the other services, and therefore we serve patients with conditions such as rheumatological conditions, endocrinological conditions, infectious diseases, my personal world, and so on. Coming from a developing world, I enjoy this patient population, the patient population we serve, because they look so much like the ones I serve in my country, with the difference that I feel that I can do something for them. So we're really not lacking anything. I mentioned cardiac catheterization, but that doesn't mean we cannot offer that to them. We have our sister institution in the medical center that performs that, and then the patients return to us once the procedure is done. So it's amazing that we can offer a first world healthcare to patients that otherwise wouldn't have in different conditions any sort of help. So, and these patients are very grateful. I mean, that's another enjoyable thing of our place, is that the expectations for the patients are mysteriously low, and yet they leave the hospital uplifted. There is a culture of mutual help where, as I like describing this, people that have an unlimited desire to help others find people that require unlimited resources from us. So it's a match made in heaven.
I totally agree. I know another very important role from my perspective is associate program director, and especially the leader of the research and scholarly activity for our residency program. Would you mind telling us a little bit about that program and how it's developed over the years?
Yes, so it's been already 5 years and ended up in a publication. The name of the program is not traded, so any viewer now can use it if they want, but we call it Scholarly Brainstorming Project. And we realize that as much as you can teach somebody to conduct research in a specific manner, or you can teach them how to write case reports and so on, in the end, what matters is, are your eyes and your associative visual cortex or parietal cortex trained to recognize when something can eventually become a scholarly product that goes from a case report, case series, retrospective research, quality improvement programs, and so on. So what we do essentially is we meet once a month with the only command of look back and see what you've seen that under certain rules that are disclosed during the meeting, you think could feed potentially a scholarly product. And what we do after 40 minutes within that hour is we stop and we present to one another and essentially discuss how that idea can be improved. Of course, we are allowed to use PubMed during the meeting. Therefore, we see if it was published before. Interesting doesn't make it necessarily publishable. So we have to twist things to make them happen. Long story short, these and many other initiatives under your direction led to a higher scholarly productivity despite the pandemic. So we are doing okay despite that. And of course, many of the products we generated have some relationship with COVID-19. I wish this is in the past very soon, but doesn't seem to be. So yeah, that's what we do, and I try to godfather the residents in that role and help them with IRB application and so on.
Well, I know it's made such a significant impact on our program, both the conference itself and just the emphasis of every month thinking about the scholarly productivity, I think has helped put rocket fuel behind all the residents' projects. Another thing I want to ask, so you are a resident here, and you know, we're trying to recruit people to become residents here. So looking back on your time, what are the things that you remember most and that you cherish from your residency? Are there things that looking back on it were most important to you?
Yeah, full disclosure, you know, I was a PGY 15 when I was a resident here. So, you know, many people are afraid of how their soul is hurting when facing new challenges in residency. Well, my back and my knees were hurting, but that has to do with age and experience. I mean, my residency had different features than any other. And nevertheless, because I have always been fascinated by what the patients bring to the arena. I mean, is that connection with the perception of you know, kind of kind of a God complex, but without the arrogance. You know, you are there to help others, and you have the perfect opportunity there, and patients are giving themselves to you for you to fix their problems, and you realize that even at Memorial Hermann, because of EMTALA and other provisions that put sometimes very poor people in a very rich environment, you realize that the social limitations for and compromising factors that explain why patients suffer so much are there everywhere. So it's trying to have a holistic approach to patient care is what I remember the most. I mean, there are plenty of examples, but you know, particularly I was interested in ID more so than general medicine at the time. So I can remember even names of patients with eosinophilic meningitis due to neurocystic sarcosis, or patients with AIDS at the time with a mass in the colon that turned out to be histoplasmosis, and you know, lots of stuff that are so exciting in the mind of a young trainee. I wasn't that young at the time, but you know, I try to pass that enthusiasm to the people working with me, the interns and students at the time, many of whom remain friends after so long.
And then what are your interests, if you're comfortable sharing them, outside of the hospital? Do you have any hobbies or things around Houston that you like to do?
Yeah, you know, I have been blessed with a fabulous family, so everybody brings their excitement and we share activities and so on. I mean, my kids are the age of the applicants now or around. So I have already a son who's a lawyer and who helps people with asylum cases in the University of Houston. Have another one who's a mathematician, works in energy and so on. And listening to their stories is already something uplifting at the time. I have a daughter who also wants to be a lawyer and is college bound now, but is you know, like a family life brings the equilibrium you need to be solid as a caregiver, as a healer to others. But besides that, you know, I enjoy music. We play music at home, and we play soccer also, and you know, it's finding activities that connect you with the real life. Not only is necessary to keep you healthy, but also, as importantly, to understand the struggles of others. You know, we are not less humans for wearing a lab coat. So having the human experience is part of becoming a better physician.
Well, thank you. I'm all out of questions. Is there anything else you think applicants should know about our program as they consider their decision?
Yes, I think it's important that we share the fact that we know who we are, and we because we are not arrogant about who we are prone to mutate into a better shape. These are the kind of mutations you want to see in any living form. And I think our program, large as it is, has uptaken ideas and recommendations from residents to make the place better for the training, for creating a comfortable learning environment. And there's a lot of merit in you, there. So I thank you for listening to them and to everyone. That is what leadership implies. So thank you.
I really appreciate your time.
No problem.